So to say that being a republic is at odds with being a democracy is just not true, and I yield back.
All right. Any other members seek recognition? Seeing none. The question is on the amendment. I don't even remember who offered the amendment. By Raskin, number 2. All those in favor of the Raskin number 2 amendment say aye.
Aye.
All those opposed say no. No. In the opinion of the chair, the noes have it, and the amendment is not agreed to.
Could we have a recorded vote on that one, Mr. Chairman?
The gentleman requests a recorded vote. Recorded vote will be ordered as previously announced. Further proceedings on the question will be postponed. Does any other member seek recognition for the purpose of offering an amendment? Mr. Lynch.
Thank you, Mr. Chairman. I have an amendment at the desk.
Will the clerk please report?
Amendment to the amendment in the nature of a substitute to H.R. 4435 as offered by Mr. Lynch of Massachusetts.
Without objection, the amendment is considered as read. I reserve a point of order. The gentleman from Massachusetts is recognized for 5 minutes to explain his amendment.
Thank you, Mr. Chairman. In the interest of what I know is our shared commitment to ensure that Americans, veterans, receive health care services that are reflective of their service to our nation, this amendment would exempt veterans' medical care from the drastic cuts in federal funding and program termination that would be required under the so-called Unauthorized Spending Accountability Act. Under the guise of fiscal responsibility, the underlying legislation targets federal programs that have continued to receive annual federal funding from Congress, but whose statutory authorization has technically expired. The bill specifies that programs and activities listed by the Congressional Budget Office in its annual report on expired authorizations are deemed, quote, unauthorized programs, close quote, and therefore eligible for extreme budget cuts and even termination absent congressional action. To the great detriment of America's estimated 18 million veterans, and particularly the more than 9 million veterans currently enrolled in the VA healthcare system, this misguided legislation places the quality and continuation of veterans' health care at risk. Considering that the Congressional Budget Office recently cited the Veterans Health Care Eligibility Reform Act of 1996 as a public law whose statutory authorization has expired, veterans' health care falls squarely within the scope of the bill and its stated goal of budgetary reduction. As underscored by the nonpartisan Congressional Research Service, the Veterans Health Care Eligibility Reform Act of 1996 is the enabling statute for the vast network of veterans' health care and medical service programs, from those providing treatment for post-traumatic stress, mental health conditions, substance abuse, to those specializing in prosthetic services, care for the homeless veterans, women's health care, and disease prevention. Over the last 2 years, Congress has appropriated more than $220 billion towards these programs and services precisely because they remain a critical lifeline for veterans with service-related disabilities and other health challenges. In my home state of Massachusetts, I've worked closely with the Home Base Program, a nonprofit organization founded by Massachusetts General Hospital and the Boston Red Sox that operates in close cooperation with the Department of Veterans Affairs and Department of Defense to provide world-class clinical care not only to veterans, but we take war fighters right from the battlefield when necessary for rehabilitation within that facility. I'm quite sure that the dedicated administrators and healthcare professionals at home base would attest to the severe challenges that drastic funding cuts at the VA would impose on their fundamental mission to treat veterans with post-traumatic stress, depression, and brain injury and other invisible wounds of war. In further support of my amendment to exempt veterans' medical care from the Unauthorized Spending Accountability Act, I would note that the bill requires a program to receive express and regular reauthorizations from Congress in order to avoid funding reductions and termination. While I firmly believe that members of this committee are united in our respect and support for American veterans, that is beyond doubt, we need only look at the recent debt ceiling crisis to demonstrate that funding for veterans' medical care should not be susceptible to political brinksmanship and the constant threat of disruption. So, Mr. Chairman, I urge our colleagues on both sides of the aisle to support this amendment, and I yield back the balance of my time.
Gentleman yields back. I recognize myself for 5 minutes. Again, I must unfortunately oppose this amendment for the same reason I opposed previous amendments. It would undermine the purpose of the bill, which is intended to force Congress to conduct oversight of the programs it creates and funds and reauthorize them regularly. If there is any place that Congress should be conducting regular oversight, it's on programs addressing our veterans' medical care. A full assessment of those priorities and the effectiveness of these programs should be conducted from year to year. While I understand this amendment is trying to safeguard veterans' medical care, I believe this amendment may actually harm the very people it's trying to help. Our veterans put their lives on the line in service to our great nation, providing the American people's safety and security. Congress has a duty to ensure our veterans are taken care of and their well-being is secure. So I would defer to my colleagues, Chairman Mike Bost and Ranking Member Mark Takano, and their members as to the legal authority and authorized appropriations of the Veterans Affairs Department needs to deliver on its mission. The House Veterans Affairs Committee should carefully weigh the future of the Veterans Affairs Department, Veterans Health Administration, and any related authorized programs. For these reasons, I respectfully oppose the amendment offered by my colleague, Mr. Lynch. Does any member seek recognition? Seeing none, the question is on the amendment offered by Mr. Lynch. All those in favor signify by saying aye.
Aye.
All those opposed signify by saying no. No. In the opinion of the chair, the noes have it, and the amendment is not agreed to.
Mr. Chairman, I'd like to request a roll call.
The gentleman requests a recorded vote. The recorded vote is ordered. As previously announced, further proceedings on the question will be postponed. Seeing that there are no further amendments on the bill, we will now take up for consideration H.R. 3230, Unfunded Mandates, Accountability, and Transparency. The clerk will please report the bill.
H.R. 3230, Unfunded Mandates, Accountability, and Transparency Bill to amend the Unfunded Mandates Reform Act of 1995 to provide for regulatory impact analysis for certain rules